predictive one, talking about our diagnosis way. So diagnosis, we know diagnosis, we have four-way diagnosis. Inspections, smelling and listening, and then palpation, ask questions. So that's basically for our diagnosis way. So still Huangdi Neijing said, Huangdi Neijing said, so if someone looking for the patients and then they know, what means knows here? Means know the illness, know the illness. So we have four ways for diagnosis, but some people, some doctors, they only looking for the patient, and then they can make a diagnosis. That means perfect kind of a doctor, perfect doctor. I think I will just changing some words here. So that's just kind of a perfect. And then some others, perfect doctor. And some others who listen, means we say we second way smelling and hearing, and then they know the illness. That's we call surgeon. Still good. Still good. And some doctors, they ask a question, and then they know it. Know means illness, can make diagnosis. They call artisan. So like, it's okay, it's fine, it's fine. And somebody, they need a field pulse. And then they know the illness. That's called scared working man. So basically, they talking about like doctors have 4 levels. They mention in Huangdi Neijing, like super, man, okay, good, and still okay, 4 different levels. What's the meaning? So that's the question here. The mentions in Huangdi Neijing, explanations in this part. Then we see what's the explanations. So basically, they say looking and know. Looking patients, basically the face. Like a patient generally coming, we immediately can look in patient's face. And then we, from the face, we can find a different kind of color there. Then we know the illness. So that's a patient from, like a doctor coming from patient's face, then the illness. So that's we say from the looking know it. From the looking know it. And listening to know it means listening for patient's voice, speak the voice. So patients speak voice, they coming from the 5 different kind of sounds. Then we know the illness. So basically relationship with different sounds. Patient yaw, that belong to the liver. Patient more laugh, that belong to heart. And the patient thin, that belong to the spleen. Patient quiet, that belong to the lung. Patient groan, that belong to kidney. So that's 5 different sounds. Yeah, 5 different sounds. We hear, and then we know the illness relationship with different organs from different levels. So okay for this page? Then we're talking about ask. Yeah, ask and know it. So that means ask a patient which kind of tasty they prefer. Like right now, we still ask patient. Even sometimes patient directly tell us, I prefer a chocolate. Yeah. So sweet flavor go to the spleen, pungent flavor go to the lung, and the salty flavor go to the kidney, and the sour flavor go to the liver, bitter flavor go to the heart. So thus ask and know it means ask a patient which kind of fever they prefer, and then know the illness location, which organs. And the field pulse to know it. Yeah, field pulse to know it. So that means checking 寸口 pulse in the west ear, 寸口 pulse, and then know what kind of condition or which 脏腑 organs disorders, then know it. So that's basically we say in Nan Jing they talking about from external situation will be no, there let be more super, and then you like more ask question or maybe hear the patient sounds or maybe feel the pulse, then know the illness. That's maybe different levels. But truly, right now, we need a combination, 4 way to make a diagnosis. But in other words, they just try to say, like looking also important. Yeah, also important. Like we looking patient's face. From external changing, then we know internal changes. So from small external changing, then we know internal changes. That may be more important. So that not means pulse is more important. We still need to look in other aspects. So that's basically in these chapters. Yeah, in these chapters. Truly they separate or full diagnosis way, looking, hearing, asking, and palpation. But right now we need combination with full way to diagnosis. So with all the way diagnosis, then that's we got the right treatment, right diagnosis. So basically, this means when we make diagnosis, we need a four-way combination together. It's not only use one way make diagnosis, but we should from external thing changing and find internal body changes. So that's these chapters. Yeah, these chapters.